Links between domestic violence and mental illness. For my final project, I would like to present on the links between domestic violence and mental illness. I believe the workings of the brain and quite a few concepts we have covered in cognitive psychology can help shed some light on this topic. First, I would like to give a little bit of background as to why I chose this for my final project. When I was in middle school, I read the book Death by Child Abuse and No One Heard by Eve Kerpinski and Dana Weekle. It is an account of the last few days of a 5-year-old girl named Ursula Sunshine Assad, who was abused and killed by her mother's boyfriend. The book made me realize I wanted to help abused and neglected children, women, elderly, and disabled. For 6 years, I was a court-appointed child advocate for the state of California, and currently I am studying to get my paralegal certificate so I may work for attorneys who represent abused and neglected individuals, primarily children. Last November, I was a witness to an assault and battery on an elderly man who was also significantly mentally handicapped. Growing up, the mother of one of my friends was killed by her husband. Another friend of mine from high school was shot by her husband. Thankfully, she survived. So what causes people to commit crimes of violence toward those who cannot defend themselves, like children, the elderly, and those who are disabled, and/or against those they supposedly love? Is it always alcohol or drug-related? What other factors can cause someone to behave so monstrously toward other human beings? Cognitive and other forms of psychology, such as neuropsychology, behavioral neuropsychology, social psychology, etc., can be used to pinpoint causes of aggression and violent behavior in people, which leads to domestic violence and other forms of abuse. First, I want to define domestic violence just to be clear. According to the American Medical Association Diagnostic and Treatment Guidelines on Domestic Violence is characterized as a pattern of coercive behaviors that may include repeated battering and injury, psychological abuse, sexual assault, progressive social isolation, deprivation, and intimidation. These behaviors are perpetrated by someone who is or was involved in an intimate relationship with the victim. The medical definition of domestic violence might differ from the legal one, but that is a subject for another day. This will focus on the medical side of abuse, mainly domestic violence. A lot of attention and focus has been given to the victims of abuse and how it affects them psychologically. This, of course, is wonderful, but I also want to dig into the behavior of the offender. Many times, victims search for a reason why the perpetrator behaved in the manner he or she did. Was the individual under the influence of something? Under great emotional distress, such as finding his or her spouse involved in a sexual relationship with another individual? Enraged? Or simply without empathy? When the authorities are called, what do they expect to find? Many times their questions revolve around alcohol or drug abuse, but could mental illness be the reason? I believe so, and not just involving psychopathy. Further, once a wife or husband realizes her or his spouse suffers from such mental illness, how should she or he respond? Is it important or a requirement to get a diagnosis? Second, I would like to look at the differences between psychopathy and sociopathy. When addressing the parts of the brain, psychopaths have reduced gray matter in their frontal lobes, increased striatal volume, abnormal asymmetry in the hippocampus, a larger corpus callosum, a lack of structural integrity in the uncinate fasciculus 2, abnormal activity in the anterior cingulate cortex, and deformations within the amygdala. Further, David P. Farrington explains that antisocial behavior in children appears to be correlated with physical abuse, parental conflict, and antisocial parents among a number of other factors, and it would not surprise anyone if this extremely stressful home life stunted the child's brain from developing normally. Some traits of psychopathy include superficial charm, lack of remorse, an impersonal sex life, and pathological lying. Paul Bobiak and Robert D. Hare clarified the difference between psychopathy and sociopathy, stating that sociopaths have traits differing from those listed above for psychopathy. Sociopathy, on the other hand, is indicative of having a sense of morality and a well-developed conscience, but the sense of right and wrong is not that of the parent culture. Also, a large component of sociopathy involves antisocial behavior. The Diagnostic and Statistical Manual of Mental Disorders combines psychopathy and sociopathy, stating, antisocial personality disorder is a pervasive pattern of disregard for and violation of the rights of others that begins in childhood or early adolescence and continues into adulthood. It is a pattern, also referred to as psychopathy, sociopathy, or dissocial personality disorder. Perez goes on to point out, while the psychopath does not experience feelings of remorse for his or her deeds, no matter how cold and heinous, the sociopath may be capable of feeling guilt and regret for his or her deeds, at least in the context of group, such as in gang affiliation or familial relationships. The sociopath, however, cares nothing for social norms and will violate them without hesitation if doing so satisfies his or her own desires or purposes. David T. Lycan states, sociopathy is often a result of environmental factors such as parenting, fatherlessness, and lack of socialization, while psychopathy can be traced to biologically inherent factors such as temperament. Lycan's list of key characteristics includes a strong need for stimulation, a complete lack of remorse or guilt, conning and manipulativeness, and a parasitic lifestyle. The psychopath is a predator who needs to hunt and stalk prey. Robert D. Hare states, psychopaths will use whatever means necessary, including violence, to control others and satisfy their wants and needs. Psychopaths display an abnormal lack of conscience and compassion. Is aggression and violent behavior limited to psychopathy and sociopathy? I do not believe so. Two conditions that appear significantly common in domestic violence cases are Asperger's syndrome and narcissistic personality disorder. When it comes to narcissistic personality disorder, there seem to be issues in the cognitive areas of sensation and perception, attention, and memory bias, etc. With Asperger's syndrome, problems look to be in sensation and perception, attention, and judgment and decision-making, among others. Though the two resemble each other in the way they manifest themselves in relationships, the pain those who exhibit Asperger's syndrome inflict on their spouse or significant other might not be intentional, whereas the harm done by individuals who display narcissistic personality disorder attributes is deliberate and calculated. Asperger's syndrome is characterized by social impairment and isolated idiosyncratic interests, as with classic autism, without a history of language impairment, unlike classic autism. Individuals with AS demonstrate clear limitations on their ability to take part in reciprocal communication and show a lack of understanding about unwritten rules of communication and conduct. Unsurprisingly, These limitations often prevent individuals with AS establishing meaningful social relationships. According to the DSM-5, narcissistic personality disorder includes a pervasive pattern of grandiosity in fantasy or behavior, need for admiration, and lack of empathy beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. Number 1 has a grandiose sense of self-importance. Number 2 is preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. Number 3 believes that he or she is special and unique and can only be understood by or should associate with other special or high-status people or institutions. Number 4 requires excessive admiration. Number 5 has a sense of entitlement, for example, unreasonable expectations of especially favorable treatment or automatic compliance with his or her expectations. Number 6 is interpersonally exploitative, for example, takes advantage of others to achieve his or her own ends. Number 7 lacks empathy, is unwilling to recognize or identify with the feelings and needs of others. Number 8 is often envious of others or believes that others are envious of him or her. And number 9 shows arrogant, haughty behaviors or attitudes. Based largely on research in social, cognitive, and personality psychology, narcissism is seen as an offensive rather than defensive condition, and no soft inner core of self-loathing is postulated. Using the concepts in our book this semester, I would like to focus on some of the behaviors exhibited in relationships involving a person showing symptoms of Asperger's syndrome and/or narcissistic personality disorder. This table lists Asperger's syndrome behavior in children, however, many of the impairments continue into adulthood. This table lists narcissistic personality disorder behavior. Do those who show signs of Asperger's syndrome and/or narcissistic personality disorder behave in an abusive manner toward others on purpose or without realizing it? As I mentioned above, when it comes to narcissistic personality disorder, there seem to be issues in the areas of sensation and perception, attention, and memory bias, etc. With Asperger's syndrome, problems look to be in sensation and perception, attention, and judgment and decision-making, among others. When information is sent to their brain, what happens? Their responses are not neurotypical. What do they perceive to be true? Are individuals who are diagnosed with narcissistic personality disorder and/or Asperger's syndrome oversensitive? Why do these individuals appear to have a short attention span? Sometimes individuals with Asperger's syndrome are misdiagnosed with attention deficit hyperactivity disorder. Without attention, you would quickly become overwhelmed by the volume of sensory information presented to your brain. In addition to Asperger's syndrome, there is sensory processing disorder, which is similar. Sensory processing disorder is a condition in which a person has difficulty organizing and integrating sensory information for use. As a result, individuals with SPD experience challenges in acting on and adapting to sensory information, making it difficult to participate in and enjoy many everyday tasks. This is a schematic model for perception and attention. The role of attention in allowing entry to the conscious mind is notoriously difficult to define. Interference can lead to memory distortions, false memories, and all-around memory bias. Where does information get lost in the mind of a person diagnosed with Asperger's syndrome or changed by an individual with narcissistic personality disorder? Narcissistic persons claim they remember events and conversations differently than their spouse or significant other. They use gaslighting to deceive, cause a victim to second-guess herself or himself, and to dominate and control a relationship. Effective interventions to reduce risk of violence among persons with severe mental illness must be comprehensive yet specifically targeted, addressing underlying major psychiatric disorder, but also addiction, trauma, sequela, domestic violence, and need for housing, income, and community support. Our findings suggest that there may be several specific subgroups within the population of individuals with SMI who are at increased risk for violent behavior. For example, one subgroup may be suffering primarily from the long-term complications of violent victimization, which may have begun in early life and is recurrent in adulthood. Addressing violent behavior in this group may require a specific clinical focus on post-traumatic stress problems. Another subgroup may consist of individuals in conflict-laden domestic relationships that may require relationship counseling, conflict resolution, anger management, or domestic violence interventions. Far more information is needed on domestic violence to help keep women and children and some men safe. A narcissistic person easily goes from one victim to the next, leaving destroyed lives in his or her wake. Spouses of men or women with Asperger's syndrome many times suffer in silence and do not have the support system she or he needs. I believe that with the help of cognitive and other forms of psychology, causes of aggression and violent behavior in people, which leads to domestic violence and other forms of abuse, can be pinpointed and addressed. Society needs this information to protect itself against abuse.